Huntington's disease, a neurodegenerative disorder. I think we've all heard of this. So similar to the other ones, sort of has a bunch of different manifestations. They tend to happen in this order. They tend to be behavioral, then cognitive, then motor. I think we often think about motor symptoms of Huntington's, but they sort of cause behavioral disturbance first. The onset is in the 20s to 50s. Remember, there's some genetic components to this. What is sort of the genetic principle that if a family of, let's say the dad has Huntington's that's diagnosed at 45, that I would expect the child's, yeah, anticipation, very good. Yeah, so each generation that the genes are passed on, the disease tends to affect people earlier. And that's because the trinucleotide repeats tend to expand with mitosis. And I believe it's more common with paternal transmission than maternal transmission to have worsening anticipation just because of the frequency at which the reproductive, whatever, with sperm, again, this is not, that's a little farther outside, but what you need to remember is anticipation. And then again, I think it's worse with paternal transmission. That's just a fact. Other fun fact, Huntington's disease was initially described by a medical student who just observed sort of this catastrophic decline in some of his patients. And later it was named after him. He was like right about most things. Pathology, I mentioned the trinucleotide repeat. You have to know that's a CAG. And the Huntington gene on chromosome 4 tends to sort of destroy a particular part of the brain, the caudate and the putamen first, and then later will sort of go after the rest of the brain. There's unfortunately no disease-modifying treatment. Right? There's nothing that stops or prevents this. We use dopamine depleting therapy. So the VMAT inhibitor that we use is tetrabenazine. You'll see reserpine in books. We don't use it anymore, but also there. And then sometimes antipsychotics to control symptoms, but that has nothing, you know what I mean? It's not treating anything. It's controlling some of the really profound psychotic symptoms that can be present in Huntington's. My question at the bottom, what other condition can present with chorea, which I didn't even define for you on USMLE exams. Chorea means dancing, right? So choreiform movements are typically, patient will be doing something, right? And they'll have a choreiform movement and they'll just kind of move it into some other part of their body. You'll sometimes see this referred to as choreoathetosis. Athetoid movements tend to be smaller. They're sort of described as snake-like. Chorea is sort of a bigger dancing movement. Athetosis is sort of smaller. Sometimes it's hard to tell which is which, so people will say choreoathetoid movements. Yeah, Sydenham's chorea, awesome. For rheumatic heart disease, excellent. Yami, Kevin, love it. So it's part of the Jones criteria. That's the S of the Jones criteria for rheumatic heart disease. Tends to happen a little bit after, but good.